In this lecture, we will discuss the impact of cardiovascular diseases on individuals and communities. We will explore different types of cardiovascular diseases, their prevalence in various regions, and the behavioral and biological risk factors that contribute to their occurrence. We will also examine the strategies that can be implemented to prevent and control cardiovascular diseases, such as primary prevention and treatment. This lecture will focus on preventing cardiovascular diseases through various methods. We will also assess the risk factors that contribute to cardiovascular diseases, interventional trials, and detailed discussion of primary and secondary prevention. Cardiovascular diseases can be divided into different categories: ischemic heart disease, stroke, rheumatic heart disease, and congenital heart disease. Cardiovascular diseases are a major health issue in both developed and developing countries. They are responsible for a significant portion of all deaths, including heart disease and stroke. The prevalence is increasing rapidly in both developed and developing countries, particularly in middle-aged adults. It is essential to understand the epidemiology of non-communicable diseases, their risk factors, and to implement effective prevention and control measures. Cardiovascular diseases in Southeast Asian region find effective prevention and control strategies to reduce their impact on public health. Non-communicable diseases such as ischemic heart disease, cerebrovascular diseases, and rheumatic heart disease are significant contributors to the disability-adjusted life years, DALYs, lost in these countries. Inflammatory heart diseases and other conditions also contribute to the DALYs lost due to non-communicable diseases. Targeted prevention and control strategies are needed to address these specific diseases and their impact on public health. Discussing the epidemiology of cardiovascular diseases in urban and rural areas. We observed early age of cardiovascular disease deaths in developing countries. There is successful management of incidence in industrialized countries. It is emerging epidemic in middle and low-income countries. What are the strategies to reduce risk factors for cardiovascular disease? It is by quitting smoking and avoiding tobacco. An inappropriate diet, high in saturated fats, salt, refined carbohydrates, low in vegetables, fruits increases risk. Maintaining a healthy diet with fruits, vegetables, whole grains, protein reduces risk. Also, physical inactivity is the risk factor. Other important risk factor is biological risk factor for cardiovascular disease. They include overweight, central obesity, high blood pressure, dyslipidemia or high cholesterol levels, and diabetes. Low cardiorespiratory fitness is also a risk factor for CVD. Obesity and diabetes are major public health concerns worldwide, with millions affected. High blood pressure and dyslipidemia increase risk of heart attacks and strokes. Low cardiorespiratory fitness affects heart and muscle delivery of oxygen and nutrients. The protective factors includes consuming linoleic acid, fish and fish oils, EPA and DHA, vegetables and fruits, potassium, whole grain cereals, nuts, plant sterols/stanols, folate and flavonoids can help protect our cardiovascular health and prevent cardiovascular diseases. Conversely, risk factors such as smoking, high blood pressure, high cholesterol, diabetes, a sedentary lifestyle, and poor diet can increase the likelihood of developing cardiovascular diseases. Therefore, managing and controlling these risk factors can help prevent and manage cardiovascular diseases. Cardiovascular diseases can also be caused by other factors such as high sodium intake, high alcohol intake, and impaired fetal nutrition. Discussing various cardiovascular diseases and associated risk factors, we will focus on modifiable and non-modifiable risk factors. Modifiable risk factors are those that can be changed through lifestyle changes and medical interventions, such as high blood pressure, smoking, and a diet high in saturated fats. These factors can be managed and controlled through lifestyle changes like exercise, a healthy diet, and medication. Non-modifiable risk factors include age, family history, and genetics, which are important to consider when developing prevention strategies, but may not be easily controlled. Cardiovascular diseases are a complex issue, and multiple risk factors may contribute to their development. Some people may have a higher risk based on individual characteristics and circumstances. Understanding and managing these risk factors is crucial for developing effective prevention and control strategies, which can reduce the incidence of cardiovascular diseases and improve overall health and well-being. We discussed primary prevention of cardiovascular diseases. We emphasized the importance of ensuring everyone has access to healthy eating habits, regular physical activity, and stress management techniques. Furthermore, we highlighted the need to monitor and control risk factors such as high blood pressure, high cholesterol, and smoking. Population-wide interventions can significantly reduce the risk of cardiovascular diseases in the population. On the other hand, individual-level intervention involves targeting specific individuals at high risk of developing cardiovascular diseases, including those with existing cardiovascular diseases, risk factors such as family history, and individuals who engage in unhealthy behaviors such as smoking or lack of physical activity. Through individual-level interventions, we can help these individuals make lifestyle changes that reduce their risk of developing cardiovascular diseases. In conclusion, both population-wide intervention and individual-level intervention are critical in reducing the burden of cardiovascular diseases. Discuss intervention to reduce cardiovascular disease burden. Cardiovascular diseases are a major health concern, affecting millions of people worldwide. These diseases can lead to serious health complications and even death. Therefore, it is important to take action to reduce the burden of cardiovascular diseases. We will be sharing some strategies that can help in this regard. We can prevent cardiovascular diseases from recurring in those who have already had them through secondary prevention measures. These measures may include medications such as aspirin, beta blockers, angiotensin-converting enzyme inhibitors, and statins, which help reduce the risk of cardiovascular events such as heart attacks and strokes. However, it's important to note that the choice of medication will depend on the individual's specific risk factors and medical history. In addition to medication, lifestyle changes can also be effective in secondary prevention. This can include regular exercise, a healthy diet, and not smoking. Remember, secondary prevention is all about taking proactive steps to maintain a healthy heart and reduce the risk of cardiovascular disease. We are now discussing coronary heart disease in detail. We have identified several symptoms of cardiovascular disease. Angina pectoris, chest discomfort, or pain caused by narrowed coronary arteries, is a common symptom. Myocardial infarction, also known as a heart attack, is another symptom that occurs when one or more coronary arteries become blocked and heart tissue is damaged. This can lead to heart failure, where the heart is unable to pump enough blood to meet the body's needs. Irregularities in the heart, such as atrial fibrillation and ventricular fibrillation, can also be symptoms of CVD. These occur when the heartbeat is irregular and can lead to serious complications such as blood clots and stroke. It's important to recognize that these are just a few of the many symptoms of CVD, and anyone experiencing these should seek medical attention. Proportional mortality ratio. The simplest measure is the proportional mortality ratio, i.e., the proportion of all deaths currently attributed to it. For example, CHD is held responsible for about 30% of deaths in men and 25% of deaths in women in most Western countries. Loss of life expectancy. CHD cuts short the life expectancy. Calculations have been made for the average gain in life expectation that would follow a complete elimination of all cardiovascular deaths if other mortality rates remain unchanged. The benefit would range for men from 3.4 years to 9.4 years, and even greater for women. CHD incidence rate. This is the sum of fatal and non-fatal attack rates. Because of its different manifestations, accurate incidence of CHD rates are difficult to compute. Mortality rates can be used as a crude indicator of incidence. Age-specific death rates. Age-specific death rates suggest a true increase in incidence and etiology of disease. Prevalence rate. The prevalence of CHO can be estimated from cross-sectional surveys using ECG for evidence of infarction and history of prolonged chest pain. Case fatality rate. This is defined as the proportion of attacks that are fatal within 28 days of onset. Measurement of risk factor levels. These include measurement of levels of cigarette smoking, blood pressure, alcohol consumption, and serum cholesterol in the community. Medical care. Measurement of levels of medical care in the community are also pertinent. Discussing the epidemiology, cardiovascular diseases are a leading cause of death worldwide, with 7.2 million deaths annually. This accounts for 12.8% of all deaths globally. Mortality rates vary widely across different regions. In the United States, cardiovascular diseases began in the early 1920s. In Britain, cardiovascular diseases began in the 1930s. Several European countries also experienced an onset of cardiovascular diseases, but it began later. Developing countries are currently catching up to the prevalence of cardiovascular diseases. Therefore, it is essential to understand international variations in the onset of cardiovascular diseases to better prevent and control them. In United States, steady decline was evident by 25% fall in mortality by 1980. Other countries, substantial declines in Australia, Canada, and New Zealand. Attributed factors are changes in lifestyles and related risk factors, example diet, serum cholesterol, cigarette use, exercise habits. Better control of hypertension. Initially, this disease was more prevalent in higher social classes in affluent societies. However, recent studies have shown a strong inverse relation between social class and coronary heart disease in developed countries. We categorize cardiovascular ailments based on risk factors. There are two main classifications: non-modifiable and modifiable risk factors. Non-modifiable risk factors include age, sex, family history, genetics, and personality traits. Modifiable risk factors include smoking, high blood pressure, high serum cholesterol, diabetes, obesity, sedentary habits, and stress. We recommend controlling and managing these risk factors to prevent and regulate cardiovascular ailments. Quitting smoking can significantly decrease the risk of death from ischemic heart disease within 1 year. After 10 to 20 years, the risk is similar to that of non-smokers. For those with a myocardial infarction, the risk of a fatal recurrence may be reduced by 50% after quitting smoking. We urge everyone to quit smoking to reduce the risk of cardiovascular diseases. Blood pressure is the single most useful test for identifying individuals at a high risk of developing ischemic heart disease. Controlling hypertension is crucial in preventing the development of cardiovascular diseases. The role of hypercholesterolemia in myocardial infarction is significant. Low-density lipoprotein is directly associated with ischemic heart disease. The total cholesterol to high-density lipoprotein ratio and apolipoprotein are better predictors of ischemic heart disease. A study conducted among population of Japan and Finland showed that population with high serum cholesterol levels had more frequency of developing ischemic heart disease. Diabetes is a major risk factor for the development of cardiovascular disease. Individuals with diabetes have a 2 to 3 times higher risk of developing cardiovascular disease than those without. Genetic factors may also play a role in the development of cardiovascular disease. A family history of coronary heart disease is known to increase the risk of premature death. Additionally, a sedentary lifestyle is associated with a greater risk of the development of early cardiovascular disease. It's important for individuals to be aware of these risk factors in order to take steps to prevent and control the development of cardiovascular disease. Some hormones, such as estrogen and testosterone, are linked to an increased risk of cardiovascular disease. Hyperestrogenemia is a common underlying factor in the development of atherosclerosis and its complications such as coronary heart disease, stroke, and peripheral vascular disease. Additionally, type A personality, alcohol consumption, and oral contraceptives can increase the risk of cardiovascular disease. It is important to understand these risk factors in order to prevent and manage them and maintain a healthy cardiovascular system. For prevention of coronary heart disease, World Health Organization recommend 3 main strategies: population strategy, high-risk strategy, and secondary prevention. These strategies can help reduce the incidence of heart disease and improve the health of our communities. Preventing cardiovascular diseases requires identifying risk factors specific to each individual and implementing population strategies. Targeting those at higher risk for developing these diseases with high-risk strategies is essential. The World Health Organization has established a prevention strategy that focuses on primary prevention in the whole population, cardiovascular disease, and how it can be controlled. Consuming saturated fats should be limited to less than 10% of total energy intake. Some reduction in saturated fat may be made up by mono and polyunsaturated fats. It is also important to reduce dietary cholesterol to below 100 milligrams per 1,000 kilocalories per day. Increasing the consumption of complex carbohydrates, such as vegetables, fruits, whole grains, and legumes, can play a major role in controlling cardiovascular diseases. It is also important to avoid alcohol consumption and reduce salt intake to 5 grams daily or less. These dietary changes can have a significant impact on the prevention and control of cardiovascular diseases. We will also discuss specific interventions and population strategies to control cardiovascular diseases. Society requires a comprehensive health program that includes effective information and education activities, legislative restrictions, fiscal measures, and smoking cessation programs. We must all take action to make this vision a reality. Focus on reducing mean population blood pressure levels by implementing a multifactorial approach based on a prudent diet. Stanford Heart Disease Prevention Program in California, which addresses various risk factors such as high blood pressure, high cholesterol, and smoking. The North Karelia Project in Finland, which also focuses on addressing multiple risk factors to prevent cardiovascular disease. Lastly, the MRFIT, Multiple Risk Factor Intervention Trial, in the U.S. is a trial that emphasizes the importance of addressing multiple risk factors to prevent cardiovascular disease. These programs and trials demonstrate that by addressing multiple risk factors, individuals can significantly reduce their risk of developing cardiovascular disease. By modifying our lifestyles and making healthy choices, we can reduce the risk of cardiovascular diseases and improve our overall health. Remember, prevention is always better than cure. These trials are aimed at preventing a second coronary attack or sudden death. 4 main types of drugs have been studied in clinical trials, including anticoagulants, lipid-lowering agents, and antithrombotic agents like aspirin and beta blockers. The results have shown that it's possible to reduce risk factors through well-planned intervention programs. The primary and secondary prevention studies promise to be the main contributors to the prevention of cardiovascular diseases. Risk factors such as elevated serum cholesterol, smoking, hypertension, and sedentary habits have been identified by studies such as the Framingham study. Key interventions include reducing cholesterol, quitting smoking, controlling hypertension, and promoting physical activity. Both single and multifactorial risk factor trials are essential to determine the most effective interventions for preventing cardiovascular diseases. Notable intervention trials include the Stanford Heart Disease Prevention Program, North Karelia Project, Oslo Study, MRFIT, and Lipid Research Clinic Study. These trials have demonstrated the effectiveness of various interventions in reducing the risk of cardiovascular diseases. In conclusion, risk factor intervention trials play a crucial role in the prevention and control of cardiovascular diseases. By identifying risk factors and implementing effective interventions, we can help to reduce the incidence of these diseases and improve the overall health of our communities. That's all for discussion on cardiovascular diseases. For updates, follow us on healthlearners.com.